Diabetes is a condition that develops because of elevated levels of glucose or blood sugar in the bloodstream. Many people with diabetes take insulin to keep their blood sugar at a normal, healthy level. There are several methods of insulin delivery, including syringe, pen, jet injector, and pump. The most common type of insulin delivery is through a syringe. An insulin dose is drawn up into the syringe from a vial and injected directly into the skin. The syringe should be disposed of in a puncture-proof sharps container designed for medical waste. Insulin pens contain pre-filled cartridges of varying doses, which are injected directly into the skin. A jet injector does not use a needle to inject insulin. Instead, a high-pressure air mechanism is used to push a fine spray of insulin into the skin. Each of these methods of insulin delivery can be used to inject insulin in several areas of the body, including the thighs, hips, abdomen, and upper arms. They are usually used several times a day. However, an insulin pump delivers insulin continuously throughout the day and can be worn on a belt or in a pocket. Insulin pumps allow people to more tightly control their glucose levels. No matter which method of insulin delivery is chosen, it is important that a person with diabetes still checks their blood sugar 3 to 4 times a day. When patients experience chronic and severe back pain, certain types of medications can be injected into the painful area of the spine in order to provide either diagnostic or therapeutic treatment. Spinal injections can be administered to various sites along the spine. Some injections are used to relieve severe back pain. Other types of injections are administered to locate the source of back pain or source of injury to the spine. These types of spinal injections are called spinal blocks. They can be injected into spinal structures such as the epidural space, intervertebral space, nerve root, or facet joint. During the procedure, anesthetics are injected into the specific area to relieve the pain. Oftentimes, a steroid is also administered to reduce swelling and inflammation. Once administered, the medications can move freely along the spinal canal, coating the nerve roots and the lining of the facet joints. This begins to numb and relieve the patient's pain. If the pain is relieved, the physician can be assured that the site of the injury had been identified.